Question 6. An 18-month-old boy presents to the clinic with his mother for evaluation of rash around the eyes and mouth. His mother states that the rash appeared 2 weeks ago and seems to be very itchy because the boy scratches his eyes often. The patient is up to date on all of his vaccinations and is meeting all developmental milestones. He has a history of asthma that was recently diagnosed. On exam, the patient is playful and alert. He has scaly, erythematous skin surrounding both eyes and his mouth. Bilateral pupils are equal and reactive to light and accommodation, and conjunctiva is clear with no evidence of jaundice or exudate. The pharynx and oral mucosa are within normal limits, and no lesions are present. Expiratory wheezes can be heard in the lower lung fields bilaterally. What is the most likely diagnosis in this patient? Viral conjunctivitis, bronchiolitis, impetigo, atopic dermatitis, or scalded skin syndrome. What are the symptoms here? The patient is very itchy rash around their eyes and the patient scratches it often. Okay, so see main keywords here are rash around the eyes, which is itchy, and a history of asthma. These are the keywords. The two of these together is enough, should lead you to thinking of a diagnosis of atopic dermatitis, right? It is an immune condition due to IgE in patients with other immune diseases like or other allergic diseases like asthma, um, which leads to this classic manifestation of itchiness and rash. It occurs due to mutation in the gene called filaggrin. The classic rash is dry, erythematous, and it is pruritic. Okay, it is itching. In infants, this is seen on the extensor surfaces of the body, whereas in adults and children, it is seen on the flexor surface. And since it is an allergic condition due to immune system of the body, the treatment here is topical steroids. And what are some of the complications of atopic dermatitis is because this is itchy and there is a lot of pruritus because of constant itching, there will occur a breakdown of skin here, which leads to secondary bacterial infections due to either strep or even herpes, uh, which will be a source of problem here, not the atopic dermatitis itself. Right? Now let's look at the other options. Viral conjunctivitis. See, here there is rash and itching around the eyes. There is nothing within the eye. There is no evidence of exudates or jaundice. Viral conjunctivitis, there will be pink eye classically and is usually preceded with a viral prodrome of say sore throat or cold or anything like say feeling feverish or uh, those are some viral prodromes. And viral conjunctivitis, there will be clear discharge, not purulent discharge, or watery discharge. Not seen here. Bronchiolitis is a respiratory condition where there can be wheezes, but there will not be these rashes that are manifested here. We are asked to diagnose what type of rash, what is the problem with the rash. Bronchiolitis is not associated with the rash. Impetigo is a strep infection of the skin, and classically in questions you have to look for the word honey crust. That is impetigo. It is usually seen around the mouth, and there will be this honey crusting of the rash, which is not seen here. And I don't think it is this itchy or pruritic, and it is not associated with asthma. It is not impetigo. Scarlet skin syndrome will manifest with classically, they'll say that there is sloughing off of the skin. The patient will have fever and there is sloughing of skin from uh, either feet or other areas, and it will be described as just a little minor trauma or a minor push or uh, on the skin will cause the skin to slough off. Okay, it is caused by Staphylococcus aureus. This is impetigo. Right? See, this is honey crusting rash here, and it's usually around the mouth or the classic place where you see it. This is the rash of impetigo.
Thanks for watching. Please give a thumbs up and subscribe for more.